Jar Oil. The company have filling stations across the country, and our rates are relatively cheaper than anyone else across the country. Jar Oil is the biggest producer and distributor of cement in the country with the most competitive prices in the market.
Axel jam si Wave.
Yo, apply. Yo, luta do dede. Luta mo nulo jël moto nga andil ma xaalis. Hello? Ano lay waxal?
Bisul mu fine.
What?
Bisul mu fine.
Oh, yes!
Wave Axina Gambia. Deposit and withdraw money, pay bills and buy mobile credit without fees. Transfer money wherever in the country for only 1% fee. At Wave. Bisul mu fine? Wave. Your money is yours.
On Tuesday, the 28th of October 2025, you're with Coffee Time with Peter Gomez. We're into the second hour of the program, and joining us now is Dr. Hamadou Lamin Samateh, the Gambia's Minister of Health. Under his stewardship, the country has seen notable strides in healthcare delivery, from expanded vaccination campaigns to the construction of new facilities. Yet, challenges remain, from rural access and infrastructure gaps to the affordability of essential medicines. So in this rare and timely appearance, Dr. Samateh sits down with us to address the pressing questions on the minds of many Gambians, but also to share the ministry's vision for a healthier, more equitable future. Dr. Samateh, thank you so very much for joining us this morning.
Thank you very much, Uncle Peter.
All right. If you weren't here at this hour, where would you be?
I would have been in the office or going around some health facilities.
Okay, so you're an early starter.
Yes, sir.
Okay. Many Gambians have noticed improvements in health infrastructure. Tell us more about, what is happening and why now.
Yeah, thank you very much, Uncle Peter. And before I came in, I heard you talking about the health sector, the importance on the radio. All sectors are important. All walks of life are important. But the health sector is particularly important because we all know without having people in a country being healthy, there cannot be any meaningful development. We couldn't do construction, agriculture, or even learn or teach if the health sector is not vibrant and providing the services for the people of this country. So that's why His Excellency, the President, takes it very seriously. And then he guides us and gives us mandates. And those mandates including fixing the health sector. What we inherited was very difficult. We were all here. Dilapidated health infrastructure, paucity of life-saving equipment, skill gaps, and so on and so forth. And of course, shortage of medications. So these were the things that we were tasked to tackle, and I believe we are tackling them to the best of our ability. Now, we are looking at the health sector, through various lenses. And those are targeted at what we want to achieve. The health infrastructure. We realized that the access to health services needed to be increased. You mentioned poor access in some rural communities. That's what we inherited. But the narrative is changing. I will start with the massive infrastructure development that we are carrying out. Edward Francis Multi-Gene Hospital, you've seen the modernization, the expansion, the renovation. When I started, each time I went around that hospital, I was wondering, what do we do with this hospital? Where do we start from? But with the help of the Almighty Allah, we stood by and then did the designs, and then government provided funding. Now, Edward Francis and the polyclinic, you've seen the modernization. There are people who came from outside. They were surprised that that hospital was the one that they left. And by the way, Edward Francis and polyclinic renovation and expansion are funded by the government of the Gambia from GLF. Now, we also doing a similar renovation across the length and breadth of the country. Facilities like Yankarantaba, Kudang, Kaur, are being renovated. Now, we are equally expanding facilities like Buyam. Through the support of the World Bank, the Buyam General Hospital is being expanded and renovated and modernized to the tune of $292 million. Brikama Bar is expanded, and we are having a theater now, maternity unit, and so on, to the tune of close to $70 million. We have in new health posts. We have new health posts, Brikama, Nyamba, Brikama, Wellingara, Tampoto, Makumbaya, Busumbala, all have new health posts. Now, we currently are building, and they are completed now, 6 health posts, throughout the country. And now we are preparing to build another 8. Funds are available. Now, I think what has happened is that the partners have seen that government is serious about the health sector. Quite a number of these projects are supported by the partners, but it's because they've seen the commitment, they've seen the transparency and accountability and the results-oriented nature of government. That is why the partners are coming on board. So a lot is happening. You talk about our new Farato Teaching Hospital, which is state-of-the-art. The first phase is almost completed. We expect it to be completed this December, which has modern 20-bed ultra-modern intensive care unit with 84 beds of observation rooms, with modern imaging center, with state-of-the-art National Public Health Laboratory, state-of-the-art blood transfusion center, and an imaging center, which will have new CT scanners, MRI equipment, fluoroscopy equipment. And with all this happening, we also buying a lot of equipment. Now, with equipment, there needs to be good services. So at Farato, Farato is going to be our medical hub. We are constructing a brand new state-of-the-art biomedical engineering center, which is going to be, which is funded by the World Bank. And then we already have a functional clinical waste management center in Farato and also in Edward Francis Small Teaching Hospital. Before now, when we do the operations, limbs or body parts are removed from human beings, plasters, dressing materials. They are thrown at the dump sites where household waste is thrown, which is very dangerous. It rains on them and it seeps into the water bodies, but that's a thing of the past now. Clinical waste management in this country is remarkable. Other countries are coming to look at what we are doing. So we have this big center when it comes to clinical waste management. Apart from these big centers we spoke about, the 7 health regions in the Gambia each has a containerized incinerator, and we have 40 facility-based modern incinerators to deal with syringes and needles. Those were being thrown away in the public. So a lot is happening when it comes to healthcare strengthening infrastructure. Now we've seen our brand new food and drug quality lab at Brusibi. That's also for the Ministry of Health. It's nearing completion, also to be completed this December, so that we are able to test food and drug that comes into this country. And we are building in Lamin CDC another central medical store so that the storage capacity for drugs in this country is enhanced. So a lot is happening when it comes to health infrastructure. Now, in Jau, Upper Salum, Upper CRR, they tend to have, especially CRR North, poor health indicators from so many years in the past. And we want to deal with that. So we thought they need to have state-of-the-art health facilities. So we're building a big health center, a big hospital in Jau, Upper Salum, and that's coupled with a host of other facilities. And inshallah, very soon we'll build a brand new general hospital in Brikama and Basse to replace this older one. So a lot is happening when it comes to health infrastructure expansion. But of course, infrastructure alone, that's just buildings.
Exactly.
We need the equipment. So these go with equipment, state-of-the-art equipment, life-saving equipment. May last year, His Excellency inaugurated 5 brand new health centers across the country. I'm sure you are aware.
Yes.
And they were fully equipped. And this equipment are state-of-the-art, modern. People came from elsewhere. They couldn't believe we have those in the country, especially in the provinces. But this is the standard. Now, what we also do is that we ensure that they have enough high-quality maternity units. Now, women who deliver, we believe, need to deliver in dignity. So now our model is that Women deliver in self-contained rooms that are fully air-conditioned with bathroom and toilet, so that they can clean up when after delivery and so on and so forth. And this is what's happening across the length and breadth of the country. Now, equipment, how to call it, health facilities, we need the people. So the skilled people. So we are investing heavily, and it is already yielding dividend in the sense that we have started postgraduate training programs for doctors to specialize in the Gambia. Uncle Peter, that is remarkable. We went to specialize outside. We knew how difficult it was, and only few of us had the opportunity to go. Now, as I speak to you, we have up to 111 young Gambian doctors who are becoming surgeons, urologists, orthopedic surgeons, pediatricians, obstetricians, and gynecologists in the Gambia at the EFSTH. How did we do that? What we did was having the vision. Because, we have to get the vision. And then we conceptualize. And then we speak to government and partners. Government itself has become very confident in the health sector, because even our colleagues, His Excellency, needs to be confident in the sector, which he does. And the partners are confident. So World Bank supported us. They brought in up to 20 high-level doctors, professors, and senior consultants from the sub-region, and those have come. They provide high-quality specialist services in the Gambia while they train young Gambian doctors and medical students. Now, also cases like, areas like anesthesia. That has been a big challenge for many developing countries. So we started a BSc program in nurse anesthesia, and they've graduated, and we are posting them to the provinces and other parts of the country so that operations are safe. They're also doing postgraduate diploma in anesthesia, midwifery, so that midwives to reduce maternal mortality, which is going down remarkably, and also perioperative nursing and pediatric nursing. We're also training people to specialize in this. So a lot is happening. We're training the laboratory scientists and so on and so forth.
As you say, a lot is happening. But then what the general public prioritizes may not be what you people in the ministry prioritize. So if I were to ask you what your top 3 priorities for the next 12 months are, what would you say these are?
So now we intend to continue increasing access, which is very, very important. Because, people, if they don't have access, that's the starting point. Yeah. So that access expansion and modernization needs to continue. We intend to continue building capacity, because really a lot of health outcome depends on the caliber of people we meet in the hospitals when we go.
Sure.
Because, we can deliver what we can only deliver from what we know, isn't it, and what we have. And of course, the availability of medicines and medical items. That is very, very high on our priority list. It's been very challenging over the years, because it's very important for us to appreciate. First of all, Gambia is a poor country. Sometimes when people talk, they talk like we are a rich country. Why are we struggling to get good roads, which government is doing very well on? Electricity, expanding electricity, water, and so on. We are doing the same for the health sector. So provision of high-quality medicines and medical consumables is high on our priority. It's been difficult because most of all of what we use in the country is imported. And how do we acquire these medicines and medical items? The government does quantification. We advertise, and when we advertise, business people participate. And when they participate, they are supposed to provide on time, but a lot of them do not deliver on time. That has been a big problem, back and forth. We've gone to Ministry of Justice with some of them for guidance and arbitration and so on and so forth. But recently, government we came together, and we put forward strategies, and that is going to continue to deal with that issue once and for all.
Recently, the ministry participated in the launch by the World Health Organization of the country's mental health investment case report. What concrete steps is the ministry taking to address, mental health gaps, in the system?
Yeah. That's very important, Peter. Mental health traditionally had been the neglected area worldwide. And people have come to the realization that it is so critical. And a lot of people seemingly okay, but have challenges and they need help. Many of us go through a lot of struggles quietly without anyone knowing, and and the perception, the stigma around mental health and so on makes it very complex. But what we are doing is to put in place the policies, because we have to get a direction. Put in place the policy, and then we now have the mental health policy, the investment case, and we're working on the mental health bill. When that is passed, that will legalize quite a lot of the actions we are going to take. And we are also training people, mental health professionals, and also we have the investment case has various components, advocacy, resource mobilization, actual treatment, and also we are training doctors and nurses in mental health care. And of course, Tanka is very high on our agenda to revamp it and modernize it so that the people get the care that they need. But of course, mental health is everyone's business, just like any other aspect of health, in the sense that the communities have a big role to play. Quite a lot of mental health cases, challenges we get here are related to substance abuse. We start in the community. So my plea is to talk to people, to advocate, to talk to the young in schools, in the communities. So as a nation, we forge ahead together to deal with mental health issues.
Mm-hmm. As we speak, the measles and rubella vaccination campaign is set to end later today. What reports are you getting in terms of public trust in the campaign, in the exercise?
Yeah, I think we're getting very positive results in the sense that a lot of people have seen the benefits of vaccination. And of course, there was a dip during the COVID-19 pandemic, but that is picking up. And this is a catch-up campaign. Every 3-4 years, it is done generally. So I think people are getting more and more confident. Of course, our team is also enhancing its strategy with regards to communication. Communication is very, very important.
Sure.
A lot of good work is being done. I'm sure you know, but we don't say much about it, and we all intend to enhance that. So thank you for having me here. This is part of the communication strategy. Quite a lot of people might not have known about all this that is happening. So we think we work for the people. We are answerable to the people, and the people need to know what we are doing. By so saying, we also talk about even the new CT scanners. As I speak to you, there are 2 brand new CT scanners in country, one to be installed in Edward Francis Small Teaching Hospital, the other in Bansang.
Not Canifing.
Well, because Edward Francis is close by, so they could share. So up country they get. But I think one thing that is very, very, very important is the issue of oxygen. You see, everybody was talking about lack of oxygen here. We didn't have a single oxygen plant in this country during the COVID-19 pandemic.
Even those who were selling oxygen were getting it from outside?
Sometimes they were getting it from outside, if their machine broke down. But now, as I speak to you, we have 5 oxygen plants in this country. Edward Francis has in Banjul 2, and associated with it is the piping system. So oxygen is piped from the machines now to the bed of each patient with air and suction possibilities. Ndeban has, in fact, it's actually 6. Ndeban has 2-in-1. One of them is 2-in-1, and the other one is a solitary one. So 3. And the 2-in-1, each unit can work independent of the other. So they have 3. And Bansang has 1.
Why equip Ndeban more than
that
Banjul?
was the COVID center. Okay. So that's why we needed oxygen so much, But this is what, we didn't inherit any oxygen plant in this country. Now we have 6 oxygen plants for Gambia. Cape Verde sent a team here to learn from what we are doing. So remarkable things are happening.
Well done. It's Pink October, as I'm sure you know, and yesterday we spoke to a survivor who had a special message for you, that the ministry, well, actually she said, Dr. Samateh, you need to do more for cancer patients, not just breast cancer patients, cancer patients in general.
So, Kupita, what we've done, we are restructuring things in the ministry. When we came in our government, we didn't meet a cancer unit at all. No unit in the ministry dedicated to cancer. We said we have to look at the structures of the ministry. So we have formed a hepatitis control program. It's a program unit now because hepatitis seroprevalence is very high in the Gambia. People don't know. Yeah. And hepatitis predisposes to liver cancer. So we said controlling hepatitis is very, very important. Now we have a hepatitis control unit. Now we equally formed a cancer control unit headed by one of our bright young doctors. So they are now looking at the cancer control strategy, and we've engaged International Atomic Energy Agency. They've worked with our team. We have a costed plan. So our plan, just to summarize, is to set up a cancer and oncology unit in the country. They've done even the design of the radiotherapy unit, the bunker. So you mentioned, you asked of my priorities, but having a cancer and oncology unit is very, very high on the government's priority list for the sector. So we reassure her that we're doing quite a lot. For the time being, we have a lot of surgeons, well, some surgeons here who are doing cancer surgery, chemotherapy, but we do not have radiotherapy equipment, and we're working very hard to have it at Farato. Equally speaking, we're working hard, and for that we have some support now from the German government, KfW, to build a multi-purpose theater for us in Farato. That theater is where we are going to have, inshallah, open heart surgery, to be able to do valvular replacement, children who have holes in their hearts, so that those holes will be closed without sending them out, and equally speaking, to be able to do kidney transplantation.
Oh, fantastic. Yeah. I hope all that comes off. But going back to breast cancer, what is being done to improve early detection and treatment, especially for patients in the rural areas?
Yeah, so we have quite some teams that go around to do screening, and also to incorporate. So what we're trying to do mainly is to integrate it into the services, so that when a woman goes for antenatal services, she gets screened for breast and cervical cancer. When a woman goes for other services in the hospital, they get this screening. That is easier, and it's already happening. So our teams are working on it. But of course, as I say again, the sensitization, letting people know that it exists, because a lot of people, it's lack of knowledge, and the knowledge gap has to be bridged so that people get to know, so that for breast, even the breast self-examination is very important, and that women do it by themselves.
Many Gambians still struggle with affordable medication. What reforms or partnerships are in place to address this problem?
So, as I said earlier, you see, the issue is with regards to medicines, with regards to health, the human body is the same whether it's New York, Japan, or anywhere. And Banjul.
A doctor will understand that.
Exactly.
A layman will not.
So I'm coming. But so Peter, the issue is we don't have all the resources those people have. If a patient has acute appendicitis, if it is in London, the treatment is the same as in EFSTH in Banjul. The equipment we need, the medicines we need are the same, the fluids we need. But they have much more resources than we do. And the other thing is they buy their materials at a cheaper rate because it's manufactured there. Our people buy, transport them, and they sell to us at an expensive price. What I'm trying to say is certainly we do not have resources to give every Gambian 100% of the medications. That we need to understand. But the government emphasizes on availability of essential medicines. And those items on the essential medicines list, government emphasizes on them. But from every now and then, a doctor might prescribe something he thinks is good for his patient that might not be on the essential medicines list. But to summarize again, what we are doing to deal with that is the National Health Insurance Scheme. The government has started that. It has been inaugurated, they have piloted it, and it is rolled out now. So we have developed a benefits package. That benefits package, if it is approved by the cabinet, is what we are going to, inshallah, roll out. And then people with the insurance card, and it's supposed to be mandatory, when they get the card, of course, there are some people will be exempted. But the formal labor force, the proposals are that they
I
contribute.
hope not the above 60s like myself.
Yes, above 60s, the elderly will be. The elderly will be, but well, Uncle Peter, you are very young still. So those exemptions are there, and the indigent, those who typically cannot afford to pay for it, certainly nobody will put any burden on them. And the fact is that it's going to be highly subsidized, and government is equally going to contribute to it. So the existence of the National Health Insurance Scheme is another avenue for government to put additional funding for the health sector, because certain aspects of revenue are earmarked for actually the National Health Insurance Scheme.
When will this, is the benefit package already before cabinet?
Yes, so it's been worked on, some partners, because stakeholders, Ministry of Finance has to get the buy-in. So it's with them, and they are looking at it, and as soon as we get the nod, we'll present that. But generally, the first phase, which is the women who have just delivered, and then the babies are getting the benefits of the service already. That's the first phase. Yeah.
Earlier on, I was talking to a politician, and he made reference to the rural-urban drift, and said that will continue as long as certain services are concentrated, within the Greater Banjul area. So, what is the ministry doing to reduce, the disparities in, healthcare access between urban and rural Gambia?
So I'm sure you can see His Excellency's development trajectory. It is widespread, whether it is roads, electricity, water, everything. And the health sector is not left behind. Quite a lot of these health facilities were built in the provinces. All 5 health centers, His Excellency inaugurated in the provinces. And we are doing one in Farah, Combo, and some in the greater Banjul areas. And then Buyam, for example. Buyam is receiving $292 million worth of infrastructure expansion. You see the hospital in Buyam, you see some of those structures. You think you are in Europe. The quality is so good, and that's what we expect. So we are decentralizing services. Now, we are not just doing that, we also providing high-level equipment and so on. Yes, postings can be a challenge. So the strategies we have, in fact, as I speak to you, we are working on providing some incentives for the workers that we do not have in the provinces, so that they will be motivated. Because we came to the realization that you might have a health official in Kanifing or Banjul, EFSTH. They get posted to Basse, and they get a reduction in remuneration. Not even parity, reduction. That's a disincentive. So we are trying to regularize that and, put in place provisions that will encourage health workers and also accommodation. If they have good accommodation, good working environment, a lot of people, that's their main motivation. And the fact that they also know at the end of the tunnel, there is light, in the sense that a lot of young doctors, and young health professionals, nurses and public health officials, they want career prospects, training opportunities, and they now see that in Gambia. So I think they are motivated.